Me. All right, we're back. Now, what did I just show you? I showed you a bradycardia. It's not hard. It's not rocket science. The QRSs look very far away from each other, and it's a simple strip that I always start with first. Now, when you look at a bradycardia, and Brady, we usually say for short, we're talking about a heart rate less than 60. Now, for any of these handouts that I come up close and I show you all the things that I'm doing, remember they are available through the link below. But this particular strip, this bradycardia, is the easiest one to start with. Now, of course, remember this. Bradycardias are not, absolutely not, who you see first. But they are important. I mean, it's an abnormality of the heart rate. To be a bradycardia, simply, it must be a regular strip. In other words, the space between the QRS complexes, or the R's that we said in the earlier video, they must be equal. And right now, we're not measuring. We're just like eyeballing it, right? Because we're keeping our lives simple for now. But let's talk about the bradycardia. And you already know where I'm going with this. You better be ready with the select all that apply for your test purposes to know what the causes of a bradycardia are. Well, I got to tell you, some of the causes mean that it's not a big deal. For example, athletes have bradycardias all the time. Would we throw them in the hospital and say, oh my God, get the atropine? No, hell no. We would say about that person to leave them alone. So how do you know if they're an athlete? You may not, but here's what you do know. You know that the first step, the first nursing action with the bradycardia is to ask the patient how they feel. Because if the patient has some cardiac symptoms, and boy, do you need to know what those are. If the patient has cardiac symptoms, then we should be a little concerned that we might have to treat that patient. And some typical cardiac symptoms, typical, include dizziness, lightheadedness, syncope, chest pain, flutters in the chest, anything that the patient thinks is different from them. Maybe they feel like the room is spinning. Perhaps they feel like they're having a hard time catching their breath. Cardiac symptoms, right? Maybe, maybe the blood pressure is really low. Well, that's a cardiac symptom. Okay, so stay with your girl now. You got to know these. Now, that would be a patient to be concerned about. I guarantee you, LeBron ain't having none of those. Yet, I guarantee you, LeBron's heart rate is definitely probably bradycardic. Totally normal for the athlete that is in shape and doing a lot of athletic activity, working out quite a bit, like basketball, right? Okay, so now if we move on from that patient and we know in our hearts of heart that that person's completely normal, let's take the average Joe Blow who's the public, right? If you look at the general public, you may have some patients with the bradycardia there too. Well, again, do they have any symptoms? Because if they don't, I don't really care. Move on. Next. So, when is it a problem? Well, it's a problem when it could possibly have been caused by us. So that's why I urge all my nurses to look and really research the patient before you give a medication like metoprolol, or before you give a calcium channel blocker, because what do we know? We know beta blockers and calcium channel blockers are primary reasons for patients in the hospital to have a bradycardia. And there you are with your patient in the 40s giving them their morning meds at 9 o'clock or 10 o'clock, and you're handing them metoprolol and they're gonna have a problem. And then you're gonna be liable. So we have to look at what is it that we could be doing that could be causing this patient's heart rate to be low. So of course, medications, specifically beta blockers, or calcium channel blockers. And these end in dipine, not all of them, but dipine, right? Nifedipine or nifedipine, dipine, whatever. You say tomato, I say tomato. But the bottom line is, remember that I said beta blockers and calcium channel blockers can cause a bradycardia and make it much worse. literally make the patient arrest, right? You can only go so low before you stop. You know that. Now let's look at some other things that may be going on. What if the patient is someone who has an electrolyte issue? Which electrolyte issue could cause a bradycardia? Well, a low calcium could cause a bradycardia. That can happen. And so when you think about hypocalcemia, you should be concerned that maybe the calcium is so low it's causing a bradycardia. Then there's this trick I like to teach you, and it is to remember the body systems, right? Cardio, respiratory, neuro, GI, you know, all those systems. Well, there's one system out of all the systems in our body that if there's a problem with this system, instead of tachycardia, we're going to get bradycardia. What system is that? That's the neuro system. Yeah, because frankly, problems in cardiac, problems in respiratory, problems in all the other issues, in cancer and infection and different things like that, those will be tachycardic issues. But this issue for neuro patients is going to be a bradycardia. So is something neurologically wrong? And that's kind of like tied into the calcium, because a low calcium will give you what? Neuro symptoms. You know, your tetany, your chavastics, your Trousseaus. Y'all remember all this stuff is tied together now. I know in school they give you something and then give you a test on the something, and then that's something you forgot until the next something. That's not what we're doing here. We're tying the entire human body in together. And so low calcium gives you neuro symptoms, and low calcium gives you bradycardia, and neuro symptoms give you bradycardia. So if the patient's ICP, or fluid on the brain, or blood in the brain, is getting worse, well, then you better remember that I said to you that that's a bradycardia. Y'all with your girl? You still with me? Come on, honey. Stay with me. Wake up! Now, next on the list, because you can't forget your endocrine. Next on the list are endocrine disorders, specifically hypothyroid. Why am I dancing? Because I got rhymes and stuff. I need you to know. When I say hypothyroid, I want you to remember slow, low, and cold. Oh, I'm sorry. I don't know where that came from. Y'all pray for your girl. Slow, low, and cold. Slow and low what? Pulse. Oh, yeah. Hypothyroid is slow, low, and cold. And what's the other name for that? Hashimoto's. Oh, a lot of little O's in there, huh? You better know it, because that's a whole nother lecture, and I will see you soon. But for now, you've been educated on bradycardia. Peace out.